Good afternoon and welcome to today's training, Psyches for County Local Government Units. My name is Melanie Martucci and I am part of the Medical Informatics team, part of OMH's Office of Population Health and Evaluation, and I'll be going through today's training. I'm also joined by Michelle Ram and Ashma Thapa, who are also part of our Medical Informatics team, and they'll be assisting with the Q&A today. So just some housekeeping before we get into the training. We will be using the Q&A feature via WebEx, so all phone lines are muted for today's training, but you may access the Q&A box in the WebEx menu at the bottom right of your screen. If you click on the three horizontal dots and select the QA option, that should open up for you. You can type questions using the Q&A feature throughout today's webinar. And by default, that will submit to all panelists, and so we can all view the questions that are submitted to Q&A. Please don't use the chat function. That won't be monitored for any of the questions during today's webinar. So again, all questions can be submitted through the Q&A feature, and those will be answered throughout today's webinar. And then we'll also leave time at the end to address some questions on air. We will have the slides and recording link emailed to all attendees as well after the webinar, and they will also be posted to the public website. So here's our agenda for the training. We'll begin with a PSYCKES overview. Then we'll talk about the difference between the LGU access versus the provider level access in PSYCKES. We'll talk about population health management with recipient search, quality improvement with MyQI report and statewide reports. We'll review client level details within the clinical summary. And then at the end, we'll review some training and technical support, and then again, address any questions on air. So beginning with the PSYCKES overview, what is PSYCKES? So PSYCKES stands for the Psychiatric Clinical Knowledge Enhancement System, and PSYCKES is a secure and HIPAA-compliant online application for sharing Medicaid claims and encounter data and data from other state administrative databases. PSYCKES is designed to support data-driven clinical decision-making, care coordination, and quality improvement, and we'll go into more detail about how to do that with reports within PSYCKES. And in PSYCKES, we also have ongoing data updates. So the data in the clinical summary is updated on a weekly basis, and then the quality indicator reports are updated on a monthly basis. So who is viewable in PSYCKES? We do currently have over 12 million New York State Medicaid enrollees, so currently or in the past enrolled in Medicaid, that have fee-for-service claims, managed care enrollees among all product lines, and those that are also dual eligible, so eligible for Medicare and Medicaid commercial. To be included within PSYCKES, you also have to be a part of the behavioral health population. So recipients that have any history of psychiatric or substance use service, psychiatric or substance use diagnosis, or have been prescribed a psychotropic medication. So if a recipient falls within this population, we will provide all data. We have data regarding general medical health, behavioral health, residential, lab, pathology, and many other types that we'll review when we get to the actual clinical summary information. So more about what data is available in PSYCKES. We, like I mentioned, have the clinical summary, and this will provide up to 5 years of data, again, updated weekly. And this includes all Medicaid fee-for-service claims and managed care encounter data across many different treatment settings. So as I mentioned, we have medications, medical and behavioral health, outpatient and inpatient services, ER, crisis, care coordination, among others. And then we also pull from the multiple other state administrative databases listed below, and those have a very quick turnaround. So there is only a 0 to 7 day lag with these data sources. I won't read through all of them, but we do have information coming from New York City Correctional Health Services. We have health home enrollment and care management information coming from DOH MAP. We have the managed care plan and HARP status information coming from the managed care enrollment table. And then you'll see on the right column, we have a lot of information coming from OMH Cares. So we have assisted or assertive community treatment provider contact information, housing and residential information coming from CARES. And we will take a closer look at a lot of these different data sources and how they look within the actual clinical summary. So all of this data is available in different types of reports in PSYCKES. So we have the individual client level reports, and that is the clinical summary. Again, that's Medicaid and the state database treatment history, and that provides up to 5 years worth of data. We also have the provider level reports. And there are 4 different types of provider level reports. We have the MyQI report, and that will display current performance on all of the quality indicators. So within those QI reports, you can review the names of clients who are flagged, and you can also enable access. So if you are a provider level user, you would enable access to get information for that specific recipient. On the other hand, if you have the state LGU access, you would have access to all of that information without having to enable consent. Similarly, for recipient search, you can run ad hoc reports to identify cohorts of interest. You can also look at a list of recipients in different advanced views, which will show you different information that you may be interested in. Again, we'll take a closer look at what the advanced views are and what we have available in PSYCKES. And again, for these lists of recipients, if you have the state access through your LGU, you would have access to all available information. If you do have that provider level access, that is where access would need to be enabled to get access to the clinical summary information from there. Next, we have the usage reports. So usage reports are helpful and they are used to monitor PHI access by staff. So you can go into the usage report and you can see who is viewing clinical summaries for specific recipients. You can see who is enabling access and by which type. So if access was enabled by a provider user via emergency attestation, or if a client consent was entered, that is something that you can view in the usage reports. We also have the utilization reports, and this is to support providers that have value-based payment data needs. Lastly, we have the statewide reports, and these are very similar to the MyQI report. However, they look at a quality indicator, and you can review statewide proportions by provider location, region and county, client residence, region and county, plan, network, and provider, and these are at the aggregate level. So regardless of what access you have, either as statewide LGU access or provider level access, you would get access to statewide reports and have that aggregate level view to that information. So next, I'll talk about the difference between the LGU versus provider level access. I mentioned a couple things, but we'll go into a little bit more detail. So for the LGU PSYCKES access level, a security manager will assign the appropriate access level depending on the role of the county staff. So if the role is a leadership role or oversight at the LGU, that is where the state level access would be appropriate. So the state level access does allow access to all available data in PSYCKES. Again, this would be the type of access where you would not need to enable consent for recipients, and you would be able to view all of that data. For direct service providers or supervisors, that is where the agency level access for county operated providers comes in, and that is where consent or emergency attestation is required to view client level data. We do have security documents available that further explain how to utilize PSYCKES access appropriately as an LGU, and these are available through our PSYCKES help desk. So if there is any uncertainty about which type of level of access you would be getting, either the LGU oversight state level access or the direct service provider agency level access, you can always reach out to our PSYCKES help desk for further explanation on that. And then we also have another tip here that if a staff was granted PSYCKES access as a provider level user and now has switched to an oversight role at the LGU and they do require that state level access, we are able to make that approval and switch of their access on the PSYCKES backend. That's another request that can be sent to the PSYCKES help desk. Just be sure to include all relevant information about your current PSYCKES user role details, and then we will be able to review that as well. So with the provider access levels to client data, there are different ways that access can be enabled within the PSYCKES application. So there is signed consent, and we have 3 different types of consent forms in PSYCKES. The PSYCKES consent, the BHCC consent, and DOH Health Home or CCO consent. So if a consent was signed, that consent would need to be enabled in the PSYCKES application, and that would allow access to all available data. So this includes data with special protections such as substance use, HIV, family planning, and genetic testing. And that consent access would be available for 3 years after the last billed service, or if the recipient decides to withdraw their consent sooner than those 3 years, then that is when the consent would elapse. We also have the verbal PSYCKES consent option, and this allows access to limited data. So you would get access to the client's clinical summary, except that would exclude data with special protections. This is also a limited duration compared to any of the signed consents. So if verbal PSYCKES consent is given and enabled in the PSYCKES application, you would only get access to that limited data for 9 months instead of that 3-year time frame. With the clinical emergency, if a clinical emergency is attested to, that would allow access to all available data, including data with special protections, but for only 72 hours. So if at your provider agency, a clinical emergency is attested to in the application, anyone at that agency would be able to access that recipient's clinical summary, but for only that 72-hour time frame. Once the 72 hours elapses, the recipient would revert back to no access, and either consent would need to be signed or given from the recipient, or if there were to be another clinical emergency in place, that would need to be attested to again in PSYCKES. Lastly, we have the attestation of service option in PSYCKES, and this is if a client is currently served by or being transferred to your agency. Maybe they haven't had an actual service yet, or they haven't been billed for, but you know that they are going to be a client at your provider agency. You can attest to service in the PSYCKES application, and this will link that recipient to your agency in recipient search reports. So if you are running any of those ad hoc searches, applying different filters, you would see that recipient name in your recipient list, but you would not be able to drill into their clinical summary unless you received one of the above forms of enabling access, like signed consent, verbal PSYCKES consent, or clinical emergency. So attestation of service is really a way to link your client's name, but that is the only information that you would be able to see in PSYCKES. So next, we will talk a little bit more about recipient search. So recipient search is used to search for either an individual client Or again, you can generate a list of clients meeting specific criteria. And some of the searches that we currently have available are below. So we have a characteristics section that you can filter for many things. Some of the ones that we like to point out specifically for the LGUs are searching by race and ethnicity, searching by region and county. We also have a special population section, and we have a filter for complex needs, high mental health need, OPWDD services eligible, OPWDD New York Star eligible, ACT AOT Health Home Plus eligible, homelessness information. We also have a section for social determinants of health, service setting categories by a specific provider or any provider. And you can look at service settings such as outpatient, care coordination, crisis services, living support and residential, and inpatient and ER services. We also have medications and diagnoses available, and we'll look at these exact sections in some screenshots. So this is currently what the recipient search module looks like within PSYCKES. You can see at the top that we have a recipient identifier section, and this is really the area where you would search for an individual client. So we have recipient identifiers such as Medicaid ID, Social Security number, or you can also use a combination of first name, last name, and date of birth. That's hidden behind here. And then if you would like to do one of the group searches or apply filters to run one of those ad hoc searches, depending on what you may be interested in, that is where the second part of the screen comes into play. So starting with the characteristics section and below, those are all of the group search areas, some of which we've mentioned so far. When you're completing a group search and applying any of the filters, it's important to note that PSYCKES does limit the results to only showing 50 recipients that meet that criteria. Many of the searches in PSYCKES may return more than 50 recipients. So if you would like to include all of the recipients in your recipient search list, you can go up to this limit results to toggle here. You can click this drop down and then expand your limit results to, and this will include the following number of recipients in your search results. So after applying any of the filters and then updating your limit results to, you can click search and this will generate a list of recipients. Looking at some of the specific sections of the areas of recipient search that you can apply filters, we'll start with the characteristics section. And one thing I want to point out is the race category. So we do have this drop down and you can select more than one race. I believe you can select up to 4. And then you can also apply an ethnicity from our ethnicity drop down. So you can layer on multiple filters if you'd like, and then run that search. In the characteristics section, I also want to point out the region filter. So the region and county listed here is based on the client's county of fiscal responsibility. So if you select a specific New York State region, then the corresponding counties will also adjust depending on that. So in this screenshot, we've selected Hudson River region. And so all of the counties within Hudson River have displayed in the county filter. It would update, for example, if you chose New York City region, we would see the New York City boroughs in the county as well. So that can be applied there. Coming to the special populations section, we have many different filters within this first population option. So we have the OPWDD services eligible RA95 filter. And this filter will look for individuals who have a restriction exception code 95 in the Medicaid system. and this will indicate their OPWDD service eligibility. We also have the any OMH outpatient specialty mental health services next. And this is also according to OMH rate build codes. So the mental health outpatient specialty services included in this filter, if applicable, are ACT, CCBHC, CDT, clinic, day treatment, HCBS, IPRT, PROS, and partial hospitalization. And even if your specific provider agency doesn't directly provide these services, this filter will help you identify if the recipients you serve have engaged in any of those services elsewhere in the past year. We also have the behavioral health high need dual Medicaid and Medicare filter, and this will identify those recipients that are ages 21 and over who meet the behavioral health high need criteria and are enrolled in both Medicaid and Medicare. And the purpose for this filter, behavioral health high need, is defined as using the same criteria that's used for the HARP algorithm. And then we also have the high mental health need filter. We'll talk a little bit more about that. Okay, so the next section of the special populations area in PSYCKES has many different filters. So in high need population, these are just a few that we like to point out specifically for LGUs. So we have the high Medicaid inpatient and ER cost filters, and this will identify behavioral health Medicaid enrollees with one or more inpatient or ER services who represent the highest cost statewide for any inpatient or emergency room services that would be linked to your organization. So we have the top 1% and then the top 5%. Also in this high need population dropdown, we like to point out the OPWDD New York Start eligible filter, and this will be based on the RE95 code, recipients who are age 6 or above and also have a mental health diagnosis. We also have this intensive mobile treatment past year, so any recipient that has received an IMT service within the past year. We have high fidelity wraparound likely eligible filter, and this will look at children and youth that are ages 6 to 21 that are health home enrolled and also have a current K3 serious emotional disturbance status or 2 or more mental health diagnoses within the past year and have met other factors. So again, this is likely eligible. It does not determine that they're definitely high fidelity wraparound eligible, but if they do meet one of those criteria, we have the recipient included in that filter search. We also have Health Home Plus eligible, and then AOT information. So active court order expired in the past 6 months, expired in the past year, along with ACT information, lots of others within this filter dropdown. Also in the special populations section, we have the homelessness alerts, and this data is coming from Medicaid and New York City Department of Homeless Services. So again, in these sections, you can select up to 4 criteria and run that search. So we have the information broken out by homelessness all sources, and then you can also separate based on that data coming from DHS or from Medicaid specifically. So lastly, in the special population section, I want to point out the complex needs filter. So previously, complex needs was sort of grouped in with the high need population, but now it does have its own filter drop down. And within this, we have the ability to search by any complex need, or you can select up to 4 complex needs criteria from either of the 2 lists below. So we have general eligibility criteria for all ages, and then additional eligibility criteria for children and adolescents 0 to 20 years. And it's just important to note that in this screenshot, this does not capture all of the criteria that is listed in PSYCKES. There is many more criteria that is included for children and adolescents. It just could not fit here. So you can get that full list in the application. The next section of recipient search are the social determinants of health categories, and these are reported in billing. And in this section, we have the main categories that you can select, or you can also expand the domain category. And then you can see the specific social determinant of health conditions that are listed within that domain. So for example, here we have problems related to housing and economic circumstances. And if you click this plus sign next to that domain category, you will expand to see all of the specific conditions within that category. And here you can select up to 4 different filters. And in the right box, it will display the conditions that you've selected. So on your keyboard, you can use the control key to select more than one. And again, those will display here. So next we have the managed care plan and Medicaid and quality flag sections. So there is a lot going on in this screenshot here, but we'll start with the managed care plan and Medicaid. Within this section here, you can search by a specific managed care plan, a managed care product line. One thing we like to point out is the Medicaid enrollment status filter. So within this dropdown, we have the option for Medicaid recertification due in the next 3 months. So this is a great filter if you would like to see any recipients that may have their Medicaid recertification due upcoming. That could be something that could be coordinated with the client. So that is an option within that filter. On the other side of the Medicaid, or not Medicaid, the managed care plan and Medicaid section, we have children's waiver status, HARP HCBS assessment status, and assessment results. Within this HARP status filter, you can search for a specific HARP status. We have all of them listed here. And then coming down to the quality flag section, by the quality flag title, you will see the as of date for the quality flag information. So the quality flags are updated monthly, whereas compared to the rest of the information in the clinical summary that is updated on a weekly basis, you'll notice this slightly different as of date that will represent the first of the month. So when that last information was updated, this is what is currently showing in PSYCKES today. We had our last refresh as of October 1st, 2025. So all of these quality flags are listed below. And again, you can select up to 4 quality flags within your search using that control key on your keyboard. We also have a link here for definitions of the quality flags. So if you click on this definitions link, you will have each of the quality flags listed along with their description. So here we have the medication and diagnosis section. So as part of the medication and diagnosis, this first part is really related to medication information. You can search by a prescriber last name, a specific drug name, and I'll note that in these search boxes, as you start typing, we do have fuzzy logic in place. So when you start typing the letters, there will be an automatic drop down that will match the information that you may be typing. So you can click on that. You can also select whether or not this is an active drug for the recipient. You can also choose active medication in the past 3 months that is requiring prior authorization. If you are interested in searching by a psychotropic drug class or non-psychotropic drug class and not by a specific drug, then you can search by those classes here. The second part is really related to the diagnosis information. So we have a section for behavioral health diagnoses and then a section for medical diagnoses. And we do have these broad categories, so you can search by any behavioral health or any mental health diagnosis. You can also select one of the main categories in these sections. So similar to that social determinants of health area, these do expand. So if I were to click this plus sign by acute stress disorder, this would expand to show me all of the specific diagnoses that fall under acute stress disorder. So you can search by that main category or one of the more specific um, that are branched underneath. And then you also have the option to search by an individual diagnosis. So you may have the diagnosis name or the ICD-10 code. And again, as you start typing into this free text box, it will expand with the fuzzy logic to match whatever you're typing. You can also expand the number of diagnoses given from more than one, and then you can choose whether or not the diagnosis is a primary diagnosis if you check this box. If you don't check that box, it will include diagnosis information for recipients at all levels. So it may not be a primary diagnosis, but if someone had a specific diagnosis as a secondary or tertiary diagnosis, that recipient would still be captured in your search by default if you're not checking this primary only box. So again, here is just some of that information on clicking the plus sign within these diagnosis categories. So here we see neurodevelopmental disorders, and then once that is expanded, you can see all of the different specific diagnoses underneath. Next, we have the services by any provider box. And this really will show information for populations who receive different types of services, including services in specific regions or counties. So you can start typing in any provider name. And again, that fuzzy logic will work where the providers will be pre-populated based on what you're typing. And then here's where you can apply that region and county filter again. We also have service utilization. So these are those broader categories. For example, you can choose inpatient ER and then choose the number of visits. And you can do 1, 2, 3, 10 plus. So we have different options in this number of visits drop down. And then for specific service settings, you can get really detailed here again by clicking on a main category, expanding that, and then seeing all of the services within that service setting category. This is just an example of what the service utilization drop downs look like. You also have that number of visits. So after I complete all of my selections in recipient search and then click my search button, this is an example of what the recipient search results page would look like after I've completed my search. So at the top of the results page, I will see the number of recipients found, and this will be the number of clients that meet criteria for whatever filters I applied. Right below the number of recipients found in the gray, you will see the criteria for the filters that you've selected. So in this example, I've chosen OPWDD services eligible, RE95. Any complex need, I've chosen the provider region as Hudson River and then the provider county as Albany. And then these are the 499 recipients that meet that criteria. So right now, the information is de-identified and is scrambled. So there is no identifying information displayed for name, Medicaid ID, date of birth, or gender. In the application, you have the option to unde-identify, and that is where you would see all of that identifying information listed. In addition to the race and ethnicity, the Medicaid quality flags that the recipient meets criteria for, and then the Medicaid managed care plan. So this is what we call our standard view, and this is what all of the recipient search results will look like and what they will include. We do have additional views that you can apply. So if you click this I next to the view option, it will open up more about the search results views. So it will let you know what all of the views display at the top. And then each of the advanced views have some additional columns that will display depending on what type of information you may be interested in. So we have the care coordination view, the high need, high risk view, hospital utilization, and outpatient providers. And these advanced views are helpful because when you toggle your advanced views and select one of the views other than the standard, it will display additional columns like as listed here. And it really gives you some more information about the client without having to individually drill into each of the clinical summaries. So you may be interested in something like Health Home Plus eligible information, and instead of having to look at 499 separate clinical summaries to view whether or not someone is Health Home Plus eligible, you could apply an advanced view and then have that information in this table and export to PDF or Excel. So in the example we have here, we've applied the hospital utilization view, and this added two additional columns with some subcolumns beneath, but it added the number of ER services in the past year and the number of inpatient services in the past year. So I can quickly see for each of these recipients the number of hospital utilization depending on whether that's ER or inpatient, and then for all behavioral health or medical, broken out really quickly in this table. And again, this can be exported to Excel here. So any of that information can be applied. I will note that for the provider level view, this information will be available for the recipients that you have access for. So consent would need to be enabled to view this information for the advanced views. But for the statewide view, it would look very similar to this, where you have access to all of that information. You also have the ability from the advanced view to drill into that clinical summary by clicking on the recipient name if you want to. Okay, so next we will move on to a different report in PSYCKES, my QI report. So the My QI report is a tool for managing quality improvement efforts. Again, the QI report is updated monthly, and within the report, we have the eligible population, which will be the denominator, and that is the clients that are served plus other parameters depending on quality indicator specifications. We also will display the number with QI flag, and that will be the numerator. So that will identify the clients who meet criteria for that specific flag. We also will compare prevalence rates for provider agency, region, and state. And then you can filter the QI report by program type, client residence, or provider location, region, or county. You also have the ability to drill down into a list of recipients who meet criteria for a flag. We have a race and ethnicity view of my QI report that we'll look at, and you can also export these reports to Excel and PDF. So my QI report will have attributing clients based on a couple of different things. So the first is billing. So clients are linked to a provider agency if they've been billed by the agency in the past 9 months. We also pull information from the MAP Health Home and Care Management Agency database. So clients that are linked to a provider agency, if they're enrolled in a health home or CMA according to MAP, will also be linked to QI reports. And then this rule is used to automatically link the clients to providers so that current clients are included in the report each month. So the period of observation for the quality indicator does depend on which measure you're looking at. So it will vary for each of the measures. For example, we have the period of observation for the high utilization quality indicator at 13 months. So that is a 13-month look back for that specific measure. This is what my QI report looks like in the application currently. We have the QI report broken out into two different sections. So on the left, you'll see the quality improvement indicators as of 10/1/2025. And these are the measures that are considered more real time and they're run on a monthly basis. You'll see we have that noted here as well in the actual report. And then on the right, we have the performance tracking measures. And these are run with an intentional lag of 6 or more months. And this is to allow for complete data to be shown in the application. These are not run by PSYCKES, but rather run by DOH, and they are taken from measures from NCQA and HEDIS. So these are not PSYCKES dependent necessarily, but we do get that information from DOH, and that is put into the PSYCKES application. So within QI report, you can also apply different filters when you are viewing any of the measures. So if you click that filter button, it will open up this pop-up and you can apply site, program type, managed care, MC product line, age group, population filters. Here you can also make those changes for client residents. So you can select to view clients specific to New York City and then a specific county, or you can look at provider location and do the same thing with those drop downs there. After any filter is applied, the filter criteria will appear in the gray at the top of the screen. So here we've filtered for client region New York City and then client county Bronx. On this page, we're looking specifically at those performance tracking measures, and one that may be of interest is the mental health performance tracking measure. So with any of the measures that are listed in the table, if you hover over the specific name of the measure, you'll get a quick definition in this hover over text. So in this screenshot, we're looking specifically at the no follow-up after mental health inpatient in the past 7 days. So if you hover over there, you can get those definitions. We also have the eligible population that I mentioned and the number with QI flag in that table. So again, the eligible population will be the denominator, and then the number with QI flag will be the number of clients that meet the actual criteria for that indicator. Here you can also see the comparison of the region and statewide percentage. Um, and then we have that displayed in a graph format as well. After you select a specific indicator within one of the indicator sets, it will open up several other tabs in your MyQI report. And one of those tabs is the recipients tab. So that will show the unique number of recipients. This is unduplicated. So each recipient will be listed, and when this is unde-identified, you would have their name, Medicaid ID, date of birth, race and ethnicity, quality flags you can see, and then for those provider level users, the current PHI access. So in this example, you can see that the name, even though it's de-identified, we can see that recipient is not in blue, it's not hyperlinked, and then we can look over here. We see that they don't have access or we don't have access, and that we would need to enable access in order to be able to drill into that clinical summary. If I had access, this may say PSYCKES consent, and this name would be blue and clickable, and I would be able to drill into that clinical summary from the MyQI report recipients tab. This list of recipients can be exported to PDF and Excel here as well. And then similarly, with our advanced views, we have two different views in my QI report. So what I was showing in the previous slide was the standard view, but you also have the option to adjust to the race and ethnicity view. And it will give you some additional details if you click the I next to this view icon as well. The race and ethnicity view will display the quality indicator prevalence rates for clients in different race and ethnicity groups. And this is available in the indicator set and the indicator tabs. So you won't have the race and ethnicity view in the additional tabs that are generated with recipient names, but you can see that at the higher level with indicator set and indicator. And I'll show you what that looks like here. So the race and ethnicity view displays the percentage and the number of clients flagged for each of the quality indicators. And again, this is broken out by different race and ethnicity groups. Medicaid data is the source for this information. So when the race and ethnicity view is applied, it is applied to both the numerator and the denominator, and a percentage is calculated. So you can see clients who identified more than one race in their Medicaid registration will be represented by the multiracial group. And then clients who identified as Hispanic or Latinx as their ethnicity are represented in the Hispanic or Latinx group only. And then for clients where race was unknown on their Medicaid billing, they are still included in this total category. But they would not be represented in one of these unique breakdowns. So when you look at a specific indicator, you can see that breakdown listed here. And it's good to note that the percentage that is calculated, for example, here for Asian, 65.2%. You can also view the exact breakdown by hovering over on the graph here. So I can see that that percentage was made up of 15 out of 23. So you can do that for any of the bars on the right. You can also export the race and ethnicity view to PDF and Excel, and it would give you the same information that you see in this table, excluding the bar graph. So I'll show you an example here. So once you export the report, you can see that breakdown listed in the table. And this will show you for the quality improvement indicators section, as well as the performance tracking indicators. So that is my QI report. Next, we will talk about the statewide reports. So again, the statewide reports is very similar to my QI report, just looking at the aggregate view. So you have the option to select an indicator set. And the indicator type will default to the summary measure of the indicator set, but you can click this drop down and select a specific indicator if you don't want to look at the summary measure. You also have the option to apply the residence, the client residence, and provider location filters here as well. And then once you generate that statewide report, again, you'll see your criteria that you've applied in the top gray section. And then the screenshot below, and also in PSYCKES, it will show you a map of New York State and it will display by provider location. By default, you can change that to client residence, but this map will identify the counties that have serviced clients who live in the New York City region. And you can see some of those percentages listed on the map. If you hover over, it will give you the same information, and that information is also displayed in the table below. So we see, for example, in the client region section, we have the state numbers at the top dark gray bar, and then that's in comparison to the criteria that I've applied for client region, specifically New York City. So you can see the comparisons. In the Client County tab, you can drill in to see a specific list of providers. So for example, if I want to look specifically at Bronx, it will open up another tab for provider. So I can see all of the providers that are within Bronx. And then I can drill in even further to look at the number with QI flags. So for example, Montefiore Medical Center is showing 759 recipients with the QI flag. If I were to click on this provider name, I would then get that list. Okay, next we will talk about the clinical summary. So a lot of this is review from earlier. The clinical summary does summarize up to 5 years of treatment history for a client, and it does create that integrated view from all of the databases that are available through PSYCKES. It will summarize treatment episodes to support rapid review. You'll be able to see episodes of care that link detailed dates of service, including diagnosis and procedure information. And the clinical summary is organized by sections like an EMR. So we'll look at some of those sections. We have general, current care coordination, notifications, active Medicaid restrictions, alerts, social determinants of health, quality flags, PSYCKES registries, plans and documents, diagnosis information, IVOS, which is an integrated view of services, care coordination, medications, outpatient services, crisis services, hospital and ER, dental and vision, living support and residential treatment, lab and pathology, radiology, medical equipment, and transportation. So there are many different sections in the clinical summary. This is what the clinical summary looks like. You'll have the recipient name at the top of the screen, the as of date for the information in the clinical summary. And then right next to that is this data sources link. And this is a really helpful PDF that will open up that includes all of the data sources in PSYCKES and the time frame of when they're updated, and also the specific detail of information that we're getting from those data sources. So we always recommend to view that data sources PDF. In the clinical summary, we also have this sections button, and this is where you can toggle to some of those specific sections that I mentioned in the previous slide. So if you don't want to scroll for 30 plus pages to find the section that you're looking for, this could be really helpful to jump to wherever in the clinical summary you want to look. One thing I'll note is that the clinical summary does default to the brief overview, but you can toggle to the full summary, which will include all information. So we have the general information at the top, current care coordination information, notifications displayed. We have plans and documents, and then screenings and assessments. So if a provider agency has entered or uploaded any plans and documents, or a screening and assessment has been completed, those would display here. One thing to know in the differences in access level is that for state users that have the LGU oversight capacity, that have access to all information, you would be able to view any plans and documents or screenings and assessments that are in PSYCKES, but you would not be able to enter those on behalf of the client. So only the providers themselves with that provider agency level access would be able to enter or upload that information. We also have the behavioral health diagnoses, medical diagnoses sections, and in these sections, anything that is blue and hyperlinked, you would be able to click on and get further level of detail for. So if I click on a specific diagnosis, it will open up a pop-up that looks very similar to this. And then you can see all of the dates of service for that specific diagnosis, the subtype, service subtype, the provider name, and then additional diagnosis information that was given. You can see there's many different pages that you could toggle to get the complete information, and then you can also export this to PDF and Excel. After the diagnosis information, we have the integrated view of services over time. And so this is what was referred to as the IVOS. And this graph really shows a view or a visual of the services over time. So you can see that it is for the past 5 years, and it's broken out and shown on the graph by either a single point of service or a continuous line to indicate something like Medicaid enrolled. So we can see continuous Medicaid enrollment for this client, or it could indicate an episode. So if there is an episode, for example, here, like inpatient mental health state psych center, we would see that in the continuous line on the graph rather than just a single point for a single date of service. On the IVOS graph, you can also click and drag your mouse over any of these points or lines, and it will increase the zoom for that specific area. So you could look specifically just at, for example, these medication for behavioral health to get a little bit more detail on what all of these services were for a specific time frame. This is the graph view, but this information is also available in a table view if that is preferred. You can toggle at the top, and that is for many of the sections in the clinical summary. So you can see here, moving on to the care coordination and then some of the medication sections, we have that information by default in a table, but you can choose to display it in a graph if needed. Again, for the sections shown here, you can click on what looks to be 2 squares or pieces of paper. And when you click on that icon, it will give you further detail regarding that service or that medication. So these show some of the last services that I want to point out today: the behavioral health services, medical outpatient services, crisis services, and hospital ER services. Again, all of this information is available in the clinical summary. We have all of the details for that specific service, either linked here or in this details button by the title of the section. And all of this information can be exported to PDF and Excel. Before we go to training and technical support, I want to pause here to see if there are any questions.
Hi, Melanie. We just had one question come in, and it was from an LGU user who had state level access, just asking about when they're allowed to view client level data. For example, if an individual has not been established with an LGU service, or if they're a high risk individual, or if they have AOT, etc., when is it appropriate for them to view the client level data? So I was thinking if anyone has any questions on when they're allowed to drill into the clinical summary and view that type of information, we do have guideline documents for LGU users that we'll be sending to the specific person who asked the question. But if anyone else is interested in viewing our LGU guidelines, they can reach out to our PSYCKES help desk and we would be happy to send them over to you. But that was the only question that came in. The other one will follow up with that user individually on their use case. So thank you.
Perfect. Thank you so much, Michelle. All right, so in our last minute, I will just quickly review our training and technical support. So we do have many PSYCKES resources on our website at www.psyches.org, including information on accessing PSYCKES, how to log in. We also have those quality indicator definitions listed there, along with many other pre-recorded webinars and recording links that you can view. If there are any questions regarding the PSYCKES application, you can always reach out to our help desk. We are available Monday through Friday, 9 to 5 p.m. at the PSYCKES help email address here. If there are any issues with the RSA token or logging into PSYCKES, it's best to contact the ITS or the OMH help desk. They do manage the tokens and logging in for all OMH applications, not just PSYCKES. So they are the best contact for that. And we have the ITS help desk listed here for OMH and state employees, and then the OMH help desk for non-OMH and non-state PC employees below. So with that, we have ended our webinar. And again, if any questions come up, please don't hesitate to reach out to either of the help desks, and we will send out the slides and recording link to everyone. I hope everyone has a wonderful rest of your day, and thank you for joining our training today.